Hello and welcome to LMH Assessment Task 2, Real Life Ethics. My name is Elysia Katsis and today I will be discussing the issue of unregulated and unauthorised treatment methods provided by chiropractors and the ethical implications of this. Ethics is defined as a branch of philosophy that deals with the conduct of people and guides the normal or standards of behaviour of people and relationships with each other. Ethics essentially serve as a guide to a way of life. It creates social norms and is the basis of legislation which dictates what behaviour is deemed acceptable and unacceptable within society in order to ensure moral standards are upheld. The behavioural norms formed by ethics guide decisions in specific situations involving an ethical dilemma. Ethical norms can vary amongst diverse populations, as norms can vary between cultures and particular societies and individuals. A second similar definition is that ethics is related to making the right choices. Often there is no apparent one right way and one must choose the best in the circumstances. The main types of ethical issues commonly faced by chiropractors include providing treatment outside their scope of practice and engaging in practice which is not based on empirical research. For example, providing advice about vaccination and taking the anti-vaccination stance, this advice of which has been formally banned by the Chiropractic Board of Australia in 2013. Supporting the theory of subluxation despite a lack of evidence, this theory of which relates to the concept that misalignment of a vertebra obstructs nerve flow by pinching spinal nerves and that spinal adjustments can correct this. And the ethical issues surrounding whether infants should be allowed to undergo spinal adjustments. Mismanagement, which will be further explored in a specific case study. The profession has unfortunately become infamous for internal conflict within its associated organisations. Failure to communicate potential risks to patients. Many chiropractors do not communicate potential risks of adjustments, which breaches the principle of informed consent. A survey conducted in 1991 by the National Board of Chiropractic Examiners discovered that 26% of practitioners utilise adjustment of the upper cervical spine as treatment for back pain and visceral disease. Only 11.1% of this treatment, however, is perceived as appropriate, and inappropriate cervical manipulation is a major risk factor for injury to the arteries in the neck, increasing the risk of stroke. 1.46 per 100,000 manipulations suffer complications and injury. It has been argued that extreme adjustment of the first two cervical vertebrae should not be performed, and the risk of stroke is considered to be significantly higher than what is currently outlined in literature at the moment. So there is a specific code of conduct for chiropractors which was developed by the Chiropractic Board of Australia in adherence to Section 39 of the National Law. The code was introduced to guide and assist chiropractors in providing safe, ethical and efficient care and treatment for patients through ensuring that all chiropractors uphold a high degree of professional conduct, provide care that is client-oriented, minimise any risks, ensure that communication with patients is open and confidential, and that the individual needs of different patients are understood and respected. The code is composed of 12 chapters. For example, the third chapter relates to working with patients and covers issues such as confidentiality and privacy of patients, informed consent, culturally appropriate practice, and responding to complaints from patients. Chapter 5 relates to respect for colleagues, and chapters 8 and 9 discuss professional performance and behaviour. Therefore, the code of conduct covers the relationship chiropractors have with patients, with colleagues, and with themselves. The code essentially ensures that consultations with chiropractors is safe for both the patient and the health professional. For example, one very significant aspect of the code is Section 9.2, which relates to professional boundaries. This section outlines the requirement that chiropractor-patient relationships must not involve the personal opinions or emotions of the practitioner. The professional boundary between practitioners and patients is aimed at ensuring that clients are not exploited financially, physically, emotionally, or sexually. The Code of Conduct for Chiropractors provides chiropractors with advice relating to legal and ethical obligations of their profession, and it is Australian Health Practitioner Regulation Agency, AHPRA, the national boards, and the National Registration and Accreditation Scheme, NRAS, which enforce this code and monitor the quality of care and services provided by chiropractors. AHPRA bases its activities on the Health Practitioner National Law, and it is this law which has resulted in 14 differing health professions becoming subject to nationwide legislation. The NRAS was developed in 2010 by both APRA and the national boards with the duty of regulating health professions and protecting the public through developing standards and legislations that all registered practitioners are to follow. Chiropractors, alongside various other professions, are included in the NRAS. APRA undertakes various roles such as supporting the national boards in upholding public safety, overseeing the registration and renewal of chiropractors in Australia, handling any complaints about specific registered practitioners, working alongside the health complaints commissions to ensure any complaints are acted on, and governing investigations about professional conduct of registered chiropractors on behalf of the national boards. In this way, APRA works alongside practitioners to uphold public safety and increase assurance among Australian communities that registered chiropractors will maintain a professional standard of practice. Okay, so the specific case study, the situation, a summary. Dr. Helen Alavaki, who was the president-elect of the CAA, the Chiropractors Association of Australia, and board director, admitted via a social media post to sneaking into a maternity ward of a hospital and performing a spinal alignment on a newborn baby. APRA have confirmed another 6 chiropractors engaging in similar practices, which has been noted on their registration, and this practice is unfortunately not uncommon. Dr. Alavaki had formed a closed Facebook group to communicate with patients and perform this illegal practice. She did not obtain any staff permission from the hospital to enter or perform the adjustment. This situation is an example of poor representation of the chiropractic profession, which is a key issue of concern in the industry. Ethical concerns raised by the case. There is currently no adequate medical evidence to support the spinal adjustment of babies. Chiropractors are obligated to refer all clients to medical professionals such as doctors and specialists when specific treatment is not in line with their scope of practice. And according to scientific and medical opinion, chiropractors should not be permitted to treat children and infants, as the subluxation theory provides limited treatment methods, and thus chiropractors are not specifically trained to diagnose and treat pediatric conditions. Despite this, in 1989, around 20 million chiropractic visits were attributable to children visits, in comparison to 87 million pediatric visits. Illnesses such as ear infections were among the conditions treated by these spinal adjustments, whereas these illnesses should be treated with antibiotics and may be outgrown according to pediatricians. However, some chiropractors delivered treatment for this condition for several weeks to a lifetime. This is an example of maintenance care that chiropractors often prescribe to children, which is arguably unnecessary. However, the chiropractic movement to treat children is growing. The WCA, World Chiropractic Alliance, advocate the idea that there is an overwhelming evidence that spinal manipulation should continue throughout the lifespan and begin at birth, and may assist in treating nerve interference in the early stages of life and thus preventing disease later in life. However, Dr. Alavaki failed to maintain a high standard of practice, and this reflects poorly on the profession as a whole. She did not have staff permission, she literally snuck into the hospital, and her actions breached Section 6.5 of the Code of Conduct for Chiropractors, provision of care in a healthcare facility. The parties involved and affected. The CBA, chiropractors as a whole profession. This event has tarnished their reputation, which may hinder trust and rapport formed between current clients and their chiropractors. Public image heavily determines whether a health professional is held with high regard. The mother and child directly involved, the hospital and hospital staff directly involved, and Dr. Helen Alavaki and her career overall. Ethical principles and theories that are relevant and the deeper meaning of this. Ethical principles. Justice. There is no discrimination involved, as Dr. Alavaki did attempt to provide treatment to a population group who is not permitted to undergo this treatment, although she is not permitted in order to ultimately protect the health and safety of the public. She did not respect the law, as she did not obtain permission to enter the hospital and performed an illegal practice on a newborn child who had no voice in this situation. Autonomy. Dr. Alavaki ultimately did respect the mother's right to make her own decision related to healthcare, and this mother's decision was probably in the best interest of her child. However, it is unclear as to whether potential dangers of the practice were communicated to the mother. If not, this breaches the principle of informed consent. Beneficence. Ultimately, the practice is illegal for a reason. It exposes the child to a potential risk to their health, well-being, and quality of life. Therefore, treating the newborn directly opposes the principle of beneficence to do good. Non-maleficence. Although it is likely that Dr. Alavaki did not intentionally aim to inflict any harm through the procedure, as she may be part of the minority who think that it is beneficial for the child, she clearly has not considered the potential harms of such procedures and provided this treatment despite it being prohibited in the medical world. How the issue can be viewed by each of the main ethical theories. Normative ethics. Deontological ethics. According to this perspective, Dr. Alavaki's actions were ethically wrong as she did not act in accordance to her professional duties. She snuck into the hospital without permission. She breached the rules of the code of conduct, which she must abide by as a professional, and she provided a treatment which is ultimately illegal and beyond her scope of practice. Consequential ethics. This is arguable. If the baby actually did obtain a benefit from the procedure, Dr. Alavaki and the mother may have been justified in breaking the rule according to this principle, as it is the specific consequence that determines whether an action is morally correct or incorrect. Again, this depends on the consequence. Virtue ethics. Technically, what Dr. Alavaki did was not morally correct from the perspective of virtue ethics, as she did not exemplify what is generally seen as good habits and good character traits, as she was dishonest, cowardice for not speaking to the medical professionals at the hospital out of fear of not being permitted to perform the treatment, and selfish if she performed this treatment for her own personal gain, for example, being paid for her service. How the issue was resolved. So the CBA, Chiropractic Board of Australia, took action against Dr. Alavaki. She was sanctioned. Memberships may be suspended or cancelled for professionals not fulfilling their ethical and legal obligations. She resigned following the incident, and although she has been permitted to continue practice, however, she must complete professional training and meet a variety of specific outlined requirements from the CBA. Recommendations for the relevant health professional body. Tighter regulation and monitoring of chiropractors is needed to ensure none are engaging in illegal practices by offering prohibited treatments. Harsher penalties for those who commit this should be enforced. Better education for all chiropractors of the risks of infant spinal manipulation and the need to refer clients to appropriate medical professionals when the issue is and required treatment is beyond their scope of work is required. Chiropractors should wait for substantial evidence to support infant manipulations before carrying out this procedure. They should be educated as to why evidence-based practice is crucial for all health professionals. The CAA themselves admit that there is certain limited evidence related to the benefits of spinal manipulation in children and infants. However, deeper research is required, and chiropractors should instead encourage their clients to voice their questions and concerns with them and other professionals in the medical field. Thank you.